Okay, so this is a couple of hours, 2.5 hours. It's all right, don't worry. And that was after an L3 stroke 4 lumbar decompression, and we stabilized that level as well. So before the procedure, you were explain what was happening.
Well, basically, it's taken a long time to sort of really get bad.
But the symptoms, were they going into the legs?
Yes.
Whereabouts?
All the way down to my feet and toes and across the side of legs, and then in the last few weeks at this side.
There. And how does it feel now?
Well, it's fine.
No pain, nothing? You can't feel anything?
I don't think so. There might be a residue of it. But
And how about your posture? Can I see your posture? I mean, do you feel you're standing straighter?
Yes, I've tried to keep doing that.
Yes.
It's been quite hard if you can't walk without
Yes.
leaning forward.
Can I see you walking now?
Yes.
Great. That's it. Look at that. Day case lumbar decompression and stabilization. You'll be going home shortly.
Yes, I can throw out that terrible thing that my husband bought me.
Oh, you've been using it, yes. You don't have to use the walking frame anymore.
The allotment, going for all this waste. Just,
Good.